Hello, welcome to Holistically Speaking. My name is Morella DeVoe. We have another wonderful show for you today, and I'm very happy that you've joined us. I also want to invite you to email us and let us know what you think of the show, or also let us know if you have any ideas or questions that you'd like us to address in other shows. Our show today is the benefits of acupuncture for children. I am really excited to get into this topic today with our guest, Gail Rex, who is a licensed acupuncturist. Welcome to our show,
Thank
Gail.
you. It's good to be here.
I'm really excited to get into acupuncture for children. Last week we had Dr. Erin Sepich, and we talked with her a lot about chiropractic for children. And when I spoke with you yesterday, I just thought, oh, this could be a really fun subject to get into, because there's so much I'm sure that parents want to learn from you or can learn from you. But before we jump into that, I just wanted to see or ask you if you could help us get a little bit of an understanding of acupuncture overall, just assuming that some people might not be familiar with acupuncture at all.
Well, acupuncture is an ancient healing art from China. The oldest records are about 2,500 years old, and it's based on a system of energy in the body, and you use generally needles that get poked into the skin to help regulate the energy as it runs through the body to promote healing and reduce inflammation. And it's not always needles. Sometimes people don't need needles. There's other techniques that we can use. There's also herbs. There's also some techniques that you do just on the skin with rubbing or massage. But generally, when we talk about acupuncture, we're usually thinking about needles.
Yeah. So before we jump into the subject on acupuncture for kids, the first thing that popped into my mind was how jittery or squeamish kids might be about the idea of needles. So are they any more squeamish than adults, or how do you handle that?
It depends on the child. Usually not, because they haven't really built up that level of fear that adults sometimes have. And little kids, I find, usually aren't very scared at all. And they don't mind the treatment. They might look, they're very interested, they want to see what's going on. Kids, there's a window from about 2 to 4 where they sometimes don't like the idea very much. And they might cry or protest at the idea. The experience is not really an issue. It doesn't really hurt them, it doesn't bother them, but they can sort of put up a very big fuss at the idea.
Yeah.
But then once they're through that window, usually from about 5 years old on, they just like it. It makes them feel good the way it makes adults feel good, so they like it.
Oh, nice. So
Usually.
Yeah. So over time they develop kind of the sense of ease around it and enjoyment around it.
Yeah, and often I've noticed some kids are actually really proud because it sounds scary to have needles, and then they find it's not scary. And I've had parents tell me that they're taking the child to the doctor for routine vaccines or something, and the kid will be like, "I'm not scared. I have acupuncture and I like it."
Nice.
So yeah.
So do the kids have to lay down during the treatment? Do they have to be still?
No, depends on the age, but usually up to age 7, the kids are sitting on their parents' lap usually, or right next to them, and the needles don't stay in. Usually with adults, needles will be inserted and then they might stay there for 10 or 15 or 20 minutes, and the adults are lying there on the table. Kids, there isn't a need for that. Kids' energy changes so quickly that you can literally put a needle in, take it out, and it has done its work. So I might do that 3 or 4 times, depending on the child, depending on the condition, depending on the age, but it really is just in and out.
Oh, wow.
And then once they're about 7 or 8, they're usually ready to lay on the table for 5 or 10 minutes.
That's fascinating. I never would have thought of that.
Yep, they change really fast.
And what's the youngest you've worked with on a kid?
That's a good question. I worked on a couple of 3-month-olds. I haven't really cataloged that way, but I can't remember how old my son was when I first needled him. But yeah.
But you worked with infants.
Yes,
Yeah.
absolutely.
So that's great because, I can imagine parents not even remotely thinking of acupuncture for their infant. So
Yeah, you don't think of it, and again, often a needle is not the thing that I would first think of for an infant. It really depends on what's going on, but there might be herbs that are appropriate. But if you have a little tiny kid who's got something going on, some digestive issue, a sleep problem, or even skin things, ear infections.
yeah, so tell us a little bit about the different conditions or things that you've treated in kids through acupuncture.
Oh, it pretty much runs a gamut, but I think just about anything you can think of. Infectious things like ear infections, particularly recurrent ones, respond really well to acupuncture. You could break that cycle of recurrent ear infection. Stomach aches, stomach issues. I particularly really enjoy working with kids with developmental delays. Not surprisingly to me, but the kids respond really well to acupuncture, and so some learning disabilities, some kind of social disabilities, kids on the autism spectrum often really respond really, really nicely, and that is just a joy.
Wow. Can you tell us about a story of a child with, on the autism spectrum? And
well, there was a little boy I treated probably, well, there's two that come to mind. One was tiny. He was about 2.5, and he hadn't been diagnosed on the spectrum yet, but that's what the doctors were thinking. But he was completely nonverbal, not mama, not dada, not anything, and sort of not really aware of his surroundings all that much. He just looked to be in a daze a lot of the time.
Right.
And I think it was after his second treatment with acupuncture, his mother called me up. She was so excited. He spoke. It was half an hour after they got home, after their second treatment, he said, "Mama."
Wow.
And it's just amazing. And then for the next couple of sessions, I could see it was like a film cleared from his eyes almost, and he started to have better eye contact and interact with people and smile at them, and
focus.
Yeah, it really made a huge
That's incredible.
difference. And that is I've also seen that with older kids on the spectrum. One of the first things to change, and one of the most heartwarming, is that eye contact ability to connect with other people.
Right. Right.
So that can be, it's just really exciting to see. Yeah.
That's incredible. I'm going to say this for you, but also for our viewers. We've been talking about the possibility of having a show dedicated to autism, and it's like, I want to have you on that
let's
show.
do it.
So tell us about some other things when you said, like, talking about infants or digestive issues. Do you ever work with like breastfeeding mothers and babies with colic? Like, what would you do?
Yeah, well, typically, colic usually is resolvable with some herbs and dietary advice for the mom. Sometimes I'll use acupuncture on ones at that age just to help. Sometimes they have a little bit of reflux or unidentifiable stomach pain, and sometimes I'll use acupuncture for that, but usually that's an herbal matter. Has to do with digestion.
Right.
That herbs that can physically be digested in the system are usually more effective for that. But ear infections are a big one. Well, they don't seem as common as they used to be.
Really?
That I've noticed, but those kind of recurring ear infections, kids with stomach aches,
Right.
asthma, although it's much better to treat it before a kid is on daily medicines and inhalers.
Yeah.
Headaches, kids with chronic headaches or chronic allergies or respiratory.
So you work, obviously from what you're saying, you work not just with the needles and kind of the energy work that traditionally associated with acupuncture, but also you integrate other aspects of Chinese medicine like nutrition and herbs
Yeah, they're really not separable in the practice of Chinese medicine. Everything that you eat and breathe and think and do in your daily life affects how you are.
Right.
And so it would be just a great waste or almost not even good practice to treat someone without talking about what they eat.
Right. So speaking of talking about what they eat, what about picky eaters? Because, you know, I work in nutrition as well, and so often we just hear parents say, oh, my kid's not going to eat that. So how do you work with parents and their kids and picky eaters?
Yeah, well, it's best to start before they get to be a picky eater. It's best to start with healthy eating habits early on. Once you have a picky eater, it takes an enormous amount of resolve as a parent to make changes, because once your child is used to eating whatever it is, the chicken nuggets or the hot dogs or the cookies and soda every day, it's going to be hard to stop that, but it makes an enormous difference. I have seen kids go from clinically hyperactive, off the wall, uncontrolled and uncontrollable to good learners just by changing what they eat.
Do you have any specific recommendations or ideas that you could give our viewing parents?
Well, it is going to vary from child to child for certain. The first thing I usually look at is the amount of non-natural chemical foods that a kid is eating or drinking. So colors, flavors, and sugars are kind of the top 3 red flags. And you know, it depends on the family. If everyone in the family is always eating chips and drinking sodas, and it's going to be very hard to stop.
Right.
But if there's been some awareness already in the family, and you can just say, oh, look, read the ingredients. You know, those so-called natural juices your child is drinking, look, you know, there's so much sugar in there, and there's red food coloring.
Yeah.
You know, try stopping that and see what happens.
Right. So the important point, as you said, is trying to work with the parents before they have a picky eater.
Yeah.
So what would your recommendations be for the parents of that, you know, little toddler or infant that isn't yet a picky eater? What should they be thinking of doing now?
The biggest thing is really, as you're starting your child on solid foods, you know, Western medicine has these very specific guidelines that you start them on cereal and you do this and you do that. And it's different in Chinese medicine. There are whole categories of food that are considered hard to digest in Chinese medicine. And a lot of those are foods that actually modern, Western, healthy, health-conscious parents think they should be giving their kids, like whole grains and fat-free foods. And those, from my point of view and what I was taught, are hard for children. If you give a child lots of whole wheat, and it's their system can't break it down, so then they end up with kind of extra phlegm and byproducts of their digestion that slows them down and prevents other kind of growth from happening. Right. So that's one that surprises a lot of people and can be really hard. When I had a child, I went out and I give him white bread. He's almost 4. He's starting to make the transition, but you know, you feel like a traitor going to the store and buying a white bread. But it's really better for most little kids. Ditto, the kind of fat-free is a danger for kids. Most parents know that now, but you really want good, healthy fats for your child.
Absolutely.
Butter and milk.
And now we're kind of getting back on the trend of realizing how vital fats are. For development. And all of that. So I wanted to switch gears a little bit, because this is just something very worthy of talking about, and it's that you have a book that you wrote many years ago. So it just tells us how much of an expert you are in Chinese medicine. So it's Chinese Medicine in Everyday Life. And it's under your maiden name, so Gail Rexstein. And so tell us a little bit about your book.
Well, the book takes on a very specific aspect of Chinese medicine, which is usually known as the 5-element theory. But it's this notion that there are kind of 5 themes or 5 building blocks of life. And they can be variously classified, but usually we talk about them in terms of wood and fire and earth and metal and water, but they describe a life cycle essentially. That something in a very early stage has certain characteristics. It grows and it spreads and it gets warmer, and then in a later stage of development things are kind of maxing out and excited and like a teenager, just kind of all out there. And then there's kind of a transitional stage where things or systems are slowing down and kind of achieving homeostasis, and they're very well balanced. And that you could kind of compare to middle age, where you're just learning what balance is. And then there's the metal element, which is something starting to decline, like your fruit tree after it's produced its fruit, and then things start to die back a little bit, and the sap might go into the roots for storage for the winter. That's a kind of condensation stage. It's very different than the expansion stage in the early part of the life cycle. It's a condensation and refinement stage. And then there's the water stage, which is a rest and restoration stage, kind of like our sleep and dreaming, where it looks like nothing's going on, but in fact, there's deep healing and deep restoration going on.
That's beautiful, because in hearing you talk about it, what I hear is that the elements correspond with the seasons in nature and the seasons of life, and even kind of daytime, cycles, and I'm sure it relates to organs.
It does. It relates to just about everything, which is what prompted me to write the book, because I found it so exciting that everything's all connected.
Absolutely. And what was fascinating is I grabbed your book, and of course, synchronistically, I open it on a page. It's like, oh, this is relevant to me. So how would someone use your book?
Different people use it differently. Sometimes people are looking for something specific about themselves, and so they might, like you, open it up and say, oh, this is me. Here's what I should eat or not eat in order to help this chronic headaches that I've been having. Or a lot of people just will read it because it's interesting. It's interesting to see how we kind of have similar cycles in our creativity and in our lives as the birds and the universe and the seasons, and it's kind of hugely comforting to see how deeply we're related to everything else that lives.
Right, and then it just gives you a different perspective on whatever might be going on with you physically.
Or emotionally, so that if you're having a difficult emotional time, you can see it in context of, oh, I understand, I'm in this period of grief right now. And look, this is what the trees are doing too, and here's what I can do to help myself through it, and this will pass, and soon I'll be in the next stage, and I'll be feeling something different.
Wonderful, thank you. And we'll share with our viewers the information about your book towards the end of the show so they can look it up. So I wanted to go back on one of the things that you said about like the constant, typical or chronic conditions that kids tend to have, like ear infections and or digestive issues. Or if you could pick one of those that maybe we could go a little deeper in and say, what might parents want to think about for that condition?
Well, let's see. We can talk about bedwetting is kind of a common one. It's for certain kids at certain stages. And in Chinese medicine, that condition can be really related to the health of the kidneys. In Western medicine as well, kidneys process the urine, but in Chinese medicine, we are often looking at perhaps the child is just constitutionally doesn't have a lot of strength, doesn't have a lot of energy. So sometimes that's just kind of the weak point in the system, and we might need to build that child up with herbs or with a little bit of warming treatments around the kidneys, or make dietary changes so that there's less energy being lost to digestion. Or sometimes there's actually, as everybody knows, there can be emotional issues connected to bedwetting.
Yeah.
So we want to take a look at that. But usually it's some combination of dietary and medical interventions to just shift how this child's body is processing the energy so that they have enough adequate energy overnight to hold the urine in. Usually there's different kinds of bedwetting that are caused by different underlying conditions. But most generally, there is a deficiency of energy that we're looking to build up.
Right. Wow, that's fascinating. The other thing that just popped into my mind is like the classic thing where parents have a really healthy child until they go into daycare or preschool, or, you know, and then they're coming home with every bug. Is that the case for every kid, or have you seen that there can be kids that are more resilient because of what they're doing?
There are kids who are more resilient. Everybody does get sick. That our bodies are designed to be able to do this, and you know, there's some science nowadays that says it's actually beneficial. Some of these microbes that we have absorbed over time have helped us evolve. So it's not a terrible thing to get a cold or a flu or a fever, as long as, you know, you get over it.
Right.
So what I always look at with kids is, are they able to get over what they catch? You know, you don't want a kid to be continuously developing sinus infections or continuously getting asthma because the short-term infection they got couldn't quite go away.
Right.
So that's what I look at, is you want to build up the system, clear out what needs to be cleared out so that the child can get better. And then, you know, it's nice to have a basic pharmacy at home of a few different things that you can give your child to help them feel better when they're sick. But it's something most of us just need to learn how to deal with, and that's okay.
Yeah. So this gets me thinking of asking you a particular question without trying to get into a hot topic, but what is your perspective, or the Chinese medicine perspective, on vaccination?
Definitely a hot topic. From my Chinese medicine doesn't really have a point of view about it, because when Chinese medicine evolved, there was no such thing. However, I was taught, and the way I see it, it's really a confusing issue. I mean, it's really, I have a lot of ambivalence about it. Generally, an individual child's immune system will respond to vaccines in both good and bad ways. So while they're developing their immunity to whatever it is, you know, whooping cough or measles, they are also building up some byproducts, some responses to the vaccine in their bodies. Some, we call it phlegm often in Chinese medicine, or some heat, some things that, so a child who already might be struggling with borderline illness, sometimes for them a vaccine could be quite dangerous. So
you assess on a case
by case, but there is really a need to protect people. So I really have mixed feelings. I generally like to suggest later, you know, changing the schedule.
Changing the schedule.
Yeah.
Excellent. So I know you brought some resources along in addition to your book. So let's take a look at those resources so you can tell us a little bit about them. And so they should be coming up. So you have, there we go.
Okay. So there's my name and our website, which is lightwavehealingarts.net.
Excellent. And then that's your book, Chinese Medicine in Everyday Life?
Yeah, its actual title is Wood Becomes Water. The Chinese Medicine in Everyday Life is a subtitle, which you could still find.
And where can people find your book?
I usually send people to an outfit called Red Wing Books, which is online, and they support a lot of Chinese medicine books and alternate healing, so I like to send people that way.
Yeah, and it just looks like a phenomenal resource, your book, for
Thank you.
people. So going back to something you said, which made me very curious, was the little pharmacy that parents should have in their house. And maybe we can wrap up the show by saying, sharing like a couple different things that they might want to keep for their sick kid.
Okay, chamomile is always really good,
Yeah.
unless you have a kid who's allergic to it. It's related to ragweed. So
Okay.
if you or your husband is allergic to ragweed, stay away from chamomile. Fennel seed is really good. A little bit of mullein leaf is nice for phlegm conditions. Echinacea is always a good one.
Yeah. Chamomile, mullein, fennel, echinacea.
Mm-hmm.
And avoiding any particular kind of food when kids are phlegmy.
Dairy.
And sugar.
And sugar.
Excellent.
That's it.
Any final thoughts that you want to leave us with today?
Just to say that acupuncture is not usually the thing that most parents think of right away when their kid is struggling, but a couple treatments can save a child from a lifetime of struggle.
Yeah, and it can start as young as infancy,
Mm-hmm.
right?
Yeah, and it can make a huge difference in their lives, and it's a really beautiful thing to see. So without chemicals, without side effects.
Yeah, wonderful. Well, thank you so much for joining us today,
It's been lovely.
Gail. It's
Thank you
been
for
really
having me.
fascinating talking to you about all of these different conditions and all the different ways in which you can help kids. So I guess we're getting a sign that we still have some time. So do you have any other tips?
I will say, if you're looking for a way to change your child's health without hurting them or having bad side effects, it's something to really consider.
Well, and the other piece that I think is really critical because of how confused parents can be with this whole vaccination topic, I think having someone like you to consult with, to get even a personalized schedule on when to get a vaccine, I think can be extraordinary, so that they don't have to feel that it's either black or white, I'm getting vaccines or not. It's just like, how can I do it in the way that's best for my child?
Yeah, it's nice for every parent to be able to make those choices. Excellent. And not feel that it has to be all or nothing.
Wonderful. Thank you again for joining us, and thank you for joining us today.